With the first half of the school year approaching fast, students will be getting their progress reports soon. Your children just got their grade cards.
And they were good.
They were good. 2 thumbs up.
That's right.
But parents might be concerned, though, if their children are having these prolonged struggles, and they might wonder that their child, could they have ADHD?
Yeah, One First Coast group of health professionals is on a mission to find solutions to attention deficit hyperactivity disorder. And earlier I got the chance to get more information from Susan Angel of CNS Healthcare, starting with whether bad grades are a sure indicator of ADHD.
Grades are one thing to consider, but you have to look at the whole picture, definitely. You may see a variation in grades, a decline in their performance, accompanied with behavior disruptions in the classroom and at home. It's not something that can just be one place. They have to have it both at home and at school.
So how can a parent tell if they think that their child might have ADHD?
Okay, outside of the grades, that type of performance, you'll also notice the kids will be restless or fidgety. Some may be hyperactive. They may talk too much or too loud, and you're always having to tell them to be quiet, stop interrupting, that type of thing. You also will see disorganization. You know, their backpacks may be a mess. You know, their desk at school may be completely disorganized. They forget, need frequent redirection.
That's my kids all the time. I'm constantly reminding them, brush your teeth, we just did this yesterday. We do this every day.
Well,
you
definitely feel like a broken record saying things, and it becomes very frustrating for the parent with these kids because they feel like they're just not getting the response they need.
So how do we depict then? What are the most common signs? Like I said, my kids show, that's just normal kids being kids, a lot of that, but what are the common signs that we should look for to determine if that is the case? Well,
obviously the grades, and then secondarily you look at the restlessness, the hyperactivity. Some of these kids may be very impulsive and make poor decisions. Like for instance, some kids may even just walk out of the school or walk out into the street in front of traffic and just not getting the consequences. When you see behaviors that are putting them at risk, either physically or in terms of their learning, they're not meeting grade standards, etc., or having problems with their peer relationships, then that may be an indication that they might need further help.
Now, do those signs and symptoms, is that depending on their age?
Well, there's certainly some things you see more common in the little bitties. They may be very hyper, maybe, just going like they're driven by a motor. And in adolescence, you may not necessarily see that as much, but you still see the inattentive symptoms, poor impulse control. There's an increase in risk-taking behaviors, maybe drugs, alcohol. They may be aggressive. They may be, getting into some situations that are pretty dangerous.
Okay, so this brings us to you guys, CNS Healthcare. What can you guys, if a kid is diagnosed with ADHD, what can you guys do to help?
Well, we do have several research studies going on for children starting age 6 up to the age of 17. And the good thing about these studies is that the medications that are being utilized are things that are already on the market, branded products that are very familiar to most people. So they've been through the safety studies. We know that they have efficacy. So it's just a matter of seeing if a research study is a good fit for you.
Now, the CNS Healthcare has helped find new treatments for ADHD. Do you know some of those and how they've been able to help?
Oh, certainly.
People?
Some of these names will be very familiar. We've worked on compounds such as Intuniv, which is out on the market, Vyvanse, Strattera, Concerta, very commonly prescribed treatments for ADHD, and we continue to do the work on those.
So then what does a parent need to do then to find out if what you guys have to offer, if that is for their child? Do they start with a physician and then work their way to you guys? What are the steps that a parent would need to do?
Certainly if they have access to a pediatrician or a physician, that's one way to go about it. But we, at our office, will have a pre-screening appointment, and it doesn't cost anything. They don't have to use their insurance or anything like that. They just simply need to schedule an appointment, and it'll take about 30 to 45 minutes. And at that time, we can get a cursory overview of the symptoms, looking at their performance at school and at home, and kind of review the study to see if it's a good fit, and then provide that as an option for the parents if they'd like to.
So can you guys diagnose ADHD, or do they need to get a doctor to see them elsewhere to say that they have ADHD and then come to you?
We have 2 board-certified psychiatrists on staff, myself, a nurse practitioner. We're all capable of diagnosing ADHD.
Okay, great. So they just have to look for those warning signs and then bring the child in, especially
for an evaluation.
Yep.
Correct. Okay. All right. Well, thank you so much. We appreciate you coming on, Susan,
Thank
for
you.
your insight. We also want to thank CNS Healthcare, of course, for sponsoring this segment.
Now remember, with CNS Healthcare, all of their services are free. No referral is needed. Diagnostic services are available with no cost or obligation, and you don't have to have health insurance coverage. To find out more about how you can get your child involved in an ADHD study, simply call 904-281-5757 or log on to their website, cnshealthcare.com.